How is invasive lobular carcinoma, ILC, staged? Imagine trying to understand how a small fire has spread in a building. That's similar to what doctors do when they stage invasive lobular carcinoma, a type of breast cancer that starts in the milk-producing lobules. Staging helps figure out how much the cancer has grown and, if it has spread, which guides treatment choices and helps predict outcomes. The system used is called the TNM system, created by the American Joint Committee on Cancer and the International Union for Cancer Control. It looks at three main things: the size and extent of the primary tumor, whether cancer has spread to nearby lymph nodes, and if it has traveled to distant parts of the body. The first stage, called stage 0, is also known as carcinoma in situ. This means abnormal cells are present but haven't invaded nearby tissue. However, in invasive lobular carcinoma, this stage is quite rare because most cases are already invasive when diagnosed. Moving to stage 1, the tumor is usually less than 2 centimeters and has not spread to lymph nodes or has only spread to a few nearby nodes. This is early-stage cancer and often easier to treat successfully. Stage 2 involves tumors between 2 and 5 centimeters. The cancer may or may not have spread to nearby lymph nodes. It's a more advanced local disease but still considered early compared to later stages. When the tumor grows larger than 5 centimeters and has spread to several lymph nodes, including those near the collarbone, it is classified as stage 3. This is called locally advanced cancer. Stage 4 is the most serious, meaning the cancer has spread to distant organs like the bones, liver, lungs, or in the case of invasive lobular carcinoma, sometimes to the ovaries, gastrointestinal tract, or uterus. This is known as metastatic breast cancer. To determine the stage, doctors use a combination of physical exams, imaging tests like mammograms, ultrasounds, and MRIs, and tissue samples taken during biopsy or surgery. Because invasive lobular carcinoma can be tricky to detect on mammograms, additional imaging like MRI is often recommended for more accurate staging. It's important to note that invasive lobular carcinoma has some unique features. It often grows in a single cell pattern, making it less likely to form a distinct lump and sometimes harder to detect early. This can lead to diagnosis at a later stage than other types of breast cancer. When it spreads, it may go to different organs than other breast cancers, such as the gastrointestinal tract or ovaries. The prognosis for invasive lobular carcinoma depends heavily on the stage at diagnosis. Early detection usually means a better outlook, while advanced or metastatic disease can lower survival chances. Other factors like tumor grade, the patient's age, and specific biomarkers also influence outcomes. In summary, staging invasive lobular carcinoma involves carefully assessing tumor size, lymph node involvement, and distant spread using the TNM system. This process is essential for choosing the best treatment plan and understanding the likely course of the disease. If you or someone you know is facing an ILC diagnosis, it's vital to discuss staging and treatment options with healthcare professionals, as each case is unique and requires personalized care. Always remember, accurate staging is a key step in managing breast cancer effectively.